this PowerPoint today. But if we don't finish, I'll just do a part 2 and finish the lecture and post a recording of it so you guys can watch later. I'd rather do that than try to rush through and skimp over things. So we'll just go through as much as we can before the class is over. If we finish, we finish. If we don't, like I said, I'll just post the rest of the recording up for you guys, okay? All right, so chapter 6, here are the different topics that I took out from the textbook that we'll be talking about. If it's not on this list, don't worry about it. You won't be tested on it. All right, so skin is part of the integumentary system. Some basic anatomy, not too complicated because it's just the skin. There are 3 different layers of the skin. There's the epidermis, the dermis, and the hypodermis, which is also sometimes called the subcutaneous tissue. The epidermis is the outermost layer, so it's what you see when you look at someone. It's a thin outer layer of cells. Below that is the dermis, which is a very dense layer. It's connective tissue. It's what makes your skin strong and elastic. And then below that is the hypodermis, or the subcutaneous layer. And this is the fatty section that helps insulate the body from losing heat. Then you also have sebaceous glands, which are in the skin. They are what secrete oil. So you get like oil on your face, your nose. Those are from the sebaceous glands. There are hair follicles, like our eyebrows, our hair on our scalp, and then there are melanocytes. They are a certain type of cell that releases melanin. This is a pigment that determines what color your skin is going to be. And here's just a quick picture of what the different layers look like. So the top part is the epidermis, the middle part is the dermis, that bottom layer is the hypodermis, or subcutaneous layer. You can also see that the sebaceous glands is that yellow fluid surrounding the hair follicles, and then there are blood vessels and nerves and different things, what have you, in the skin as well. All right, so the first condition we're going to talk about right now is seborrheic dermatitis. Derm refers to skin, and itis is inflammation, so some type of skin inflammation. This is a condition where the sebaceous glands are inflamed. This is also called, some of you might have heard of cradle cap in babies. They get that like scaly patches on their head. So this is the medical term for cradle cap. Symptoms of this is that it affects the scalp, eyebrows, lids, nose, kind of like anywhere on the face and head. You'll see red skin with yellow, greasy appearing scales. It may also be itchy. Here's a picture of it on the face, and then here's a picture on a baby. So this is what they call cradle cap. It's just greasy scales from the overproduction of the sebum from the sebaceous glands. Okay. So etiology, the cause, the sebaceous glands are overproducing too much sebum. This is sometimes caused by an organism called Pityrosporum, which is a yeast. Sometimes that can cause the sebaceous glands to overproduce. Otherwise, if it's not caused by the yeast, it's an idiopathic cause. Idiopathic meaning they don't know why it happens. It's just one of those things that happens sometimes. Diagnosis is inspection. It's pretty easy to identify and diagnose. For treatment, they're going to do cortisone, hydrocortisone creams. So because it's an inflammatory condition, right? And cortisone helps with inflammation. So they have creams you can put on the skin. You can use special dandruff shampoos as well. If someone's got thick scales like this, you can use a comb to pull out the scales to loosen them up and remove them. So that's basically that. Any questions about that one? All right, this one is contact dermatitis, so it's a different type of inflammation of the skin. This one is an inflammatory response that's caused by some external substance triggering it. So usually like some kind of, the typical one people think of is poison ivy. So you touch poison ivy and the oils from the plant cause a reaction on your skin. But more than poison ivy, different things can cause it as well. So there's latex gloves. People have a latex allergy causes their skin to react. Some dyes and soap, some detergents, some makeups, some metals, like people put earrings in and their ears swell up or turn green. That's a jewelry allergy. Some medications can do it as well. There is an antibiotic called tetracycline that is known for causing this. Anybody know what photosensitivity is? So sensitivity to light, right? So you're more likely to get a sunburn or have a rash from the sun went on tetracycline. This is a very common antibiotic, and it's a very common side effect. So what it looks like is that there's gonna be a bunch of redness, maybe some swelling, and then vesicles. Vesicles are like these little blistery blebs that ooze fluid, so that is a vesicle. And they itch, burn, or sting depending on the specific reaction. Diagnosis is just, again, based off of visual inspection, asking the patient, like, hey, did you touch poison ivy, or do you have a latex allergy? And again, treatment is going to be topical and oral corticosteroids depending on how bad it is. So if it's a small patch of poison ivy or a small area, you can just put a cream on there. If it's widespread, like all over the body, you're probably going to have to take oral corticosteroids to combat it. I have an allergy to poison ivy, and I don't have it as bad as my husband. He cleaned out the backyard, and he had poison ivy all over his whole body and had to take oral corticosteroids. We're grateful that we didn't burn it, because we have a bonfire that we burn the brush, because if you burn poison ivy and you inhale the oils, you can have poison ivy reaction in your lungs, and then that could be a very fatal condition if not treated immediately. So imagine having that inside your trachea and in your lungs. Okay, last type of dermatitis is called atopic dermatitis, or the common name is eczema. So eczema is more of just a kind of a chronic inflammation of the skin. It's not like something acute like poison ivy where you have it and it goes away really quickly. Symptoms in children tend to be more, let's see, do I have a picture? No, I don't have a picture. So children tend to have more vesicles and more exudative. Exudative means to be leaking fluid rash, whereas adults' eczema tends to be more dry and leathery. So it tends to look worse in children. They tend to be more red, more like kind of wet, whereas the adults it's more dry, looking more like elephant skin kind of. Location tends to be on creases in the body, so like certain parts of the face, but like inside the elbows, behind the knees is a very common place for eczema. What causes it is just different flare-ups, and each person has different things that triggers it for them. So some people it's stress, some people it's the climate, so like either hot or cold changes in temperature. Certain clothing materials like wool is a common one that causes eczema. With babies, it tends to be a milk sensitivity, so trying to figure out if it's breast milk or if it's a certain formula that they're using that's causing it. Diagnosis, again, is just looking at it and getting a medical history, like, hey, what have you noticed something is flaring it up? Is something causing it more than others? Unfortunately, this is not curable. It's just kind of a chronic condition that people have. So the goal of treatment isn't to cure it, but just to reduce flare-ups and manage the itching, because it can be very itchy. That's what pruritus is under the symptoms, is dry, leathery patches with that's what to say pruritus, not pruritic. So to treat it, you can use just different moisturizers, cortisone creams. Those will help reduce the inflammation and itchiness. If you do get a secondary infection from scratching, people can scratch it a lot, and then bacteria can get into the wound. You can take antibiotics to treat that secondary infection. But here is a picture of what eczema might look like, the dry, scaly patches here. Any questions about those? Any of the dermatitises? Okay. All right, urticaria is the medical term for hives. So this is an allergic reaction, severe itching and redness. So very itchy, wheals. A wheal is something that looks like this. So it's like areas that are raised, and to the touch, you can feel that they're raised. Depending on where the hives are, depends on what kind of symptom you'll have. So on the skin, it'll look like a rash with wheals. If you have urticaria develop in your stomach, maybe from something you ate, you'll get severe abdominal upset, kind of cramping, indigestion. If it develops in your airway, it can lead to asphyxiation, so it can make your trachea swell up, make it difficult to breathe. And have you ever heard of anaphylaxis? So that's an example of this. And if it gets into the deep tissues, like in the muscles and the tissues themselves, it can cause angioedema. And this is what angioedema looks like, where it causes severe swelling, this can be a medical emergency, right? If someone can't breathe through their mouth, they can suffocate. So this is a medical emergency. You can see it can be anywhere on the face, the eyes, the lips, the tongue. Causes of this is just someone has a hypersensitivity allergy to something, whether it be a medication or like a bee sting. Common ones are bee stings, peanuts, shellfish. A penicillin is an antibiotic. It's very common for people to have this kind of reaction to. Diagnostics is, again, just looking at it. You can tell by looking if they're having angioedema or if they're having this typical rash with the wheals on it. Treatment is really just to try and avoid the triggers as much as possible. So if you know you have a bee sting allergy, avoid that as much as you can. If you do happen to start developing hives, treating it as quick as possible. So an antihistamine is going to be very effective. So like Benadryl is an antihistamine. What it does is it blocks the effects of histamine, which is what's causing this allergic reaction. Epinephrine is also used if it's an emergency, like if someone has extreme angioedema or hives in their airway causing asphyxiation, and that's what we call an EpiPen. People carry those around, and that combats the immune system. Because what's happening here is that your immune system is overreacting to some substance and causing this reaction. So here's just kind of an idea so we can understand what histamine does. Once this histamine gets activated, this is what your immune system does to react to a substance that they determine is a threat. It causes all these different things. So the ones that we talked about, the stomach upset, you can see with the picture, it says stimulation of gastric acid. So that's why people are having stomach upset, because they're trying to digest whatever the harmful thing is. So if you eat something you're allergic to, your stomach's going to try and digest it quicker. So all that stomach acid is going to hurt it. The airway starts closing. That's the picture of the lungs. The dilation of the blood vessels means that your blood vessels are going to get really big, and that's when edema happens. So like when the blood vessels get really, really big, water is able to ooze out of them, and it causes all the swelling, like with the angioedema, for example. And here's just a little better picture for those who are like looking. Histamine are those little yellow dots, and in this case, this is reacting to like a bacteria through the skin, but it could be just as well. It could be reacting to a bee sting or peanuts, for example. They're going to attack that substance, and it causes all the white blood cells and all this extra red fluid to come rushing to the area, which causes the swelling. So that's what's happening. So that's why we want to have an antihistamine to prevent histamine from doing all these different things. And again, just another picture for those who are visual of all the things that histamine does. So histamine causes the capillaries, which are just the small blood vessels, to widen. So you can see that the far end is wider than than this end. Is just showing that it causes vasodilation. The increased permeability, you can see that there's space between the cells here, whereas like there's no space between the other ones. So that causes the leakage of the fluid out. So the cells separate, and that causes the fluid to escape. The attraction of leukocytes. Leukocytes is just the medical term for what? White blood cells, right? So they're calling, it's like calling for help, like, hey, help us attack this substance. So all the white blood cells are going to be coming to attack the area. And then, just as a systemic response. So you have just a fever, and that's why you have an elevated white blood cell count. So these are the different things that histamine does. Vasodilation, edema because of the permeability, and white blood cells rushing to the area. So those are the effects of histamine. All right, psoriasis. Psoriasis is similar to eczema, and we'll talk about that in a second. This is also a chronic skin condition that results in flaky red patches that might also have white silvery scales on it. So here's kind of a picture of what that might look like for psoriasis. Looks kind of similar to eczema. So symptoms are those silvery scales, which they call plaques. They usually have no discomfort. It could be maybe a little itchy. Skin is usually very dry and or cracked. Psoriasis may also develop as a result from physical trauma to an area. So my dog, actually, she got a tear in her ear from playing with another dog, and when it healed, it ended up getting like a hard scaly overgrowth on it, kind of like this. So that would be an example of like a psoriasis developing on an area of physical trauma. So she doesn't have these anywhere else on her body. It just happened from whenever she gets some kind of injury, and the psoriasis kind of takes over instead of healing normally. And that happens with people as well. Etiology-wise, they suspect it's an autoimmune disorder where the body's attacking itself, and that's what's causing this reaction. There are certain things that can precipitate developing psoriasis. So pregnancy is one of them, stress, climate changes, and also certain drugs as well can cause people to have a psoriasis breakout. Diagnosis, again, is just going to be visual inspection. Eczema might be a differential diagnosis. Remember, a differential diagnosis is just, it could be this, it could be that. We're not really sure until we know for sure exactly what we're working with. And then for treatment, the goal, again, is just going to be try to reduce the inflammation and slow down the cell growth. So these plaques are like an overgrowth of cells. So if you can slow down the rate at which the cells are growing, it'll help prevent some of the psoriasis. Ultraviolet light actually can be used as well to help treat psoriasis. I'm not really sure what the pathophysiology is behind that, but it helps to reduce psoriasis symptoms. Also putting steroid creams, again, because it's inflammation, and oatmeal baths. Oatmeal baths are really helpful for just calming down the skin. So that's psoriasis. And then here's kind of a slide about the difference between eczema and psoriasis. So eczema, like I said, tends to affect skin folds. So like an area where there's like friction, like in the elbow creases or behind the knee creases, where psoriasis can really kind of just show up anywhere, not necessarily in folds. And then eczema tends to be itchier, and psoriasis is usually thicker and has more defined scales. So here's kind of a picture difference between psoriasis and eczema to kind of see what the difference might be. And then here again is another picture of the difference between eczema and psoriasis. Okay, any questions so far? Let's check in. All right, so rosacea. Rosacea is also a chronic inflammation disorder, but this is specifically affecting just the face. Symptoms of this one, oftentimes people might not even realize they have rosacea. They might just think that they have a bad sunburn or just kind of some red acne, because it's a very slow, progressive reddening of the face. Basically what happens is that anytime that someone gets flushed or blushes or like physical exertion causes blood to rush to the face, the vessels continually widen, and every time that blood comes to the face like that, it makes the face redder and redder and it doesn't go away. There is also another like subtype of rosacea that affects the sclera and makes the eyes just really bloodshot as well. But typically when people talk about rosacea, they just mean like the skin. No one really knows why this happens. It does tend to happen more often in light-skinned people. Diagnosis, again, just gonna be inspection. Usually by, most of these are gonna be an inspection by a dermatologist, just because the skin is a little bit more specialized and there's so many different rashes and different lesions that can appear on the skin, and it can be kind of hard for the average practitioner to identify all of them. So typically a dermatologist will be able to identify them by inspection. There is no cure for rosacea either. Again, the treatment is just to try to avoid situations that cause facial flushing. Unfortunately, there's a lot of things that can cause facial flushing: exposure to sunlight, hard exercise, like when you have blood pumping, even extreme temperatures, spicy foods, hot drinks, alcohol, all of those can cause blood to rush to your face. Sunscreen use is recommended. They can use lasers to kind of try and zap some of those blood vessels to kind of treat it if it's an extreme case. They've also found that in some people, for some reason, sometimes antibiotics or antifungal creams can help. There's also this gel called Mirvaso gel, which basically causes the blood vessels to constrict, which will then push the blood back out of the area so that the blood isn't just sitting and pooling in the face. But this is a picture of what rosacea looks like. It just, again, it does kind of look like either acne or sunburn, but it's just the presence of blood in the face from the blood vessels. All right, acne vulgaris. Most of you know what acne is, if you've experienced some of it. Basically, this is caused by inflammation of the sebaceous glands. Remember, the sebaceous glands are what produce sebum, or that oil, and around the hair follicles. So the symptoms of this, they might be papules, pustules, or comedones, and this is kind of a picture of what those would look like: pustules, papules, comedones. So there's different types of acne, right? Whiteheads, blackheads, what have you. The most commonly are in the face, but they can also appear on the back, on the neck, more common in adolescence because of hormonal changes, which is a big trigger. There are some foods that can trigger it as well. So I know for me, coffee and chocolate is a trigger for me for acne. Some people have different things. Sometimes also allergies. So if you have an allergic reaction to some kind of clothing or cosmetics, it can cause some acne to develop. What happens is that there's an overproduction of oil, and it causes the skin cells to shed faster, and then they kind of clump together and form a clog inside of a pore. And that's how the pimples are basically formed. Sometimes also that can promote a bacterial overgrowth inside where that pore is clogged. So sometimes you can have a bacterial infection on top of the acne. And in that case, that is when someone would be treated with antibiotics, whereas not everyone who has acne needs to have antibiotics. Vitamin A, there's a vitamin A cream that also sometimes helps reduce skin oil and promotes the skin to dry. One of the most common prescription medications for acne is called Accutane. The medical term is isotretinoin. Maybe you've heard of it. I know some people have been on Accutane. This one, it's very effective in treating certain types of acne that is caused by excessive sebum production. However, Accutane is a very potentially dangerous medication. One of the biggest side effects being depression, psychosis, and suicidal ideation. So it's kind of a controversial drug because it works really well, but most of the time people who have acne is adolescents, and then adolescents who have suicidal ideation is usually not a good combination. So it's given very conservatively. And then here's just a picture of what's happening. So you can see the hair follicle, the sebum from the sebaceous gland is starting to collect, and then there's like this big collection of it forming the inflammation in the pore. All right, we've talked about this one actually already when we were in the immune chapter, so a couple units ago, herpes zoster, but it's come up again in the skin because it is a skin disorder. So herpes zoster, this is a viral infection. It's the same virus that causes chickenpox. So, and if you remember, herpes zoster virus causes chickenpox when you're a child. Once you've gotten infected with it, you have the virus for life. It's just kind of lying dormant. It lies dormant in your nerve cells, actually, and then for whatever reason, when you get older, something triggers it, whether it be stress or sickness or illness, it flares up and you get exposed again. So it will start flaring up on the nerve areas. So let me show you a picture here. We haven't talked about nerves a ton, but the nerves come out of the spine. So, and these pictures here, like the red, the green, and the blue, show the pathway of the nerves that are coming out of the spines, and these are called a dermatome. So, like, part of this, you can tell kind of which nerve is being affected by which part of the skin it's on. So, like, if the rash shows up somewhere on the upper back, you know that it's, in the green area, so it's one of those thoracic nerves, for example. So that's just called a dermatome. So when you have a flare-up of herpes zoster or shingles, they form along the dermatomes. They will be only on one side and they will never cross the midline. So here's an example. So you can see that the rash has formed along what they call this dermatome, and on the left side they show you which nerve the virus must have been laying dormant in. Does that make sense? So the virus is lying dormant in a specific nerve, and when it flares, it will show up on the skin above where the nerve is, and it will never cross over the spine. So you notice that it's only on the right side of the spine. It won't cross over to the other side. That's what it means by not crossing midline. Don't really know why, but that's just one diagnostic test to know whether this is herpes zoster or if it's something else. So the symptoms, like I said, following the dermatomes, usually a patient will describe a burning or tingling sensation a couple days before the rash appears. And they are these red blistery lesions, and then as they start to go away, they'll crust over and make a scab. The thing with these is that they are extremely painful. They've been described as like excruciating by some people. The vesicles, let's see if there's another picture. No, I guess that's it. Secrete like this fluid that can cause the scabbing. That's the exudate there. People who are more at risk for shingles are those who are immunocompromised, people who are older. It's extremely contagious, so if someone has it, try not to go around other people. What causes this? Let's see, we talked about that one already. Diagnosis. All right, so looking at the dermatome pattern, you can figure out whether this is herpes or something else. You can also scrape some of the vesicles as they appear and kind of put it in a, culture it to see if the virus grows. You can tell that it's herpes zoster from those scrapings. And then the treatment goal here is to make the patient comfortable, again, because it's extremely painful. So analgesics, those are painkillers. Steroids, this is going to help with the inflammation because it is an inflammatory disorder. Acyclovir is the main drug that is used to treat herpes zoster. And this, we've talked about acyclovir when we talked about antivirals back in chapter 3. Acyclovir will help prevent the replication of the virus. So it basically makes the progression of the disease shorter. Viruses or antivirals don't kill viruses. Like antibiotics do kill bacteria, but we don't have anything that kills viruses, just slows them down. If the pain is too severe, they can do injections of lidocaine. Lidocaine is like the same kind of thing they inject like when you go to the dentist into your mouth, and it gives you that like that numb lip and numb gum feeling. So they can inject that actually into the nerve so that the nerve can stop constantly firing off those pain signals. Or if it gets bad enough and it's just not going away, they can even do a nerve resection, which obviously is the last case scenario. Basically, that's where they like cut the nerve off from the branch so that it's not receiving signals anymore. But then that leads obviously to permanent nerve damage and lack of sensation, basically forever. To prevent getting shingles, you can have either the Zostavax or the Shingrix vaccine. So those two things will help prevention of herpes zoster. Also, if you've never had chickenpox when you were a child, and let's say you interact with someone who has shingles, you won't automatically get shingles, you will get chickenpox, because the very first time you interact with this virus, you get chickenpox. It's only the second flare-up of the disease that causes the shingles. Any questions about that one? That one was kind of a lot. No? Okay. All right. Impetigo. Impetigo is a very contagious superficial skin infection. So this one, you'll see reddened skin and honey-colored crusts that develop over the vesicles. So here you can see there's got a little bit of red skin, but like the fluid leaking out of the vesicles makes this like honey-colored film or crust that is characteristic of impetigo. What's causing this is a bacterial infection. So one of two bacteria, either Staphylococcus or Streptococcus, as we know them as strep or staph. You ever heard of like a staph infection? That's from Staphylococcus. These tend to be spread either by insects and just poor hygiene in general. So these tend to be common in areas that are like high poverty or low nutrition or overcrowdedness. They often tend to be common breakouts in like daycares or schools just because there's so many children, and children, obviously they're nasty, right? They got boogers and snot, and they touch everything, and they don't wash their hands. So it's all sorts of illnesses are common to have in daycares. Same thing when we talked about with like hepatitis A, right? So it's just very common to have breakouts in areas of high concentration of people. Diagnostics again is usually just by inspection. Most of the derm diseases can be just visualized and know what it is. There's also something called a Tizank test. Anytime that there's a vesicle and the vesicles show up with a lot of skin disorders, you can use a scalpel to scrape some of the fluid out of it, and then you can look under the microscope to see, like, do you see viruses, do you see bacteria, or what's going on. So that test is kind of useful anytime there is a vesicle. Treatment-wise, since it is caused by a bacteria, so antibiotics are going to be the go-to. Mupirocin is an ointment, kind of like, what's it called? Neosporin is like an antibiotic ointment, but mupirocin is just stronger. It is an ointment you can put on topically, or you can take oral antibiotics depending on how bad it is. Okay. Any questions over that one? I know you guys are probably brain dead after an exam, so don't feel free to email me later if you do have questions as you go through it on your own. Okay, so cellulitis. Cellulitis, again, is inflammation because it says itis. This is also a bacterial infection, but this is a infection of not just the superficial level, like impetigo, but this is like deeper into the subcutaneous tissue that's inflamed. Okay, so Symptoms are going to be like extreme redness, that's erythema. Pitting edema. Do you guys remember what pitting edema was? It's where you press on it and it like leaves an indent with all the fluid. So let's see if I have, did I have a picture of the, yeah. So this is pitting edema where there's so much fluid that you press with your thumb or any other finger and it leaves an indent from all the fluid that you just squished out. Okay, so pitting edema, the skin will be extremely tender, very hot to the touch. There might even be some red streaking that go along the lymph nodes. That basically, if you see streaking, which is it's kind of a blurry picture, but it's the best one I could find. You can see how like there's like the source of the infection is that black ulcer, but then there's like red streaking all the way up the arm. That means that the infection has gotten into the lymph vessels and it's causing inflammation as it goes through the vessels. Okay, so that's called streaking. The cause of this is, like I said, bacterial. It's also caused by streptococcus or a staphylococcus. So again, a strep infection or a staph infection. Basically, someone has a small cut somewhere, and if this type of bacteria gets into the skin, you get cellulitis, and these bacteria are releasing toxic enzymes that was what's causing the breakdown of the skin cells. Again, diagnosis is going to be mostly visual. You can tell by the pitting edema. You can do a blood culture. You're taking a sample of someone's blood and seeing if it comes back positive for strep or staph. Treatment is going to be systemic antibiotics. This is like people usually, depending on how bad it is, are hospitalized so that they can get IV antibiotics to fight this. And it is very painful. So again, analgesics, which are just painkillers. So that's streaking. This is a picture of what cellulitis looks like. You can see the area of redness and how swollen it is. It kind of looks like a bad sunburn. But some of them can be so severe that like the skin breaks and you have like these open wounds. So it can be pretty mild like this one, or it can be much worse depending on how bad it can get. All right, so this one, dermatophytoses, is actually a category, and then there are, let's see, 5 different things that fall under these. So this is, dermatophytoses is an umbrella term that encompasses all these different types of fungal infections. So all of these are caused by fungi, and they're all named Tinea something. So Tinea, and then what the different name is based off of the location. So it's the same fungus, but depending on where it is on the body is what different name it has. So if it's on the scalp, it's Tinea capitis, you can think of like wearing a cap. If it's on the body, it's Tinea corporis, which is also known as ringworm. If on the nails, it's Tinea unguium. On the feet is Tinea pedis, and on the groin is Tinea cruris. So I'll start at the top. Tinea capitis, this one is more common in children, so it's rare in adults. It's like round, gray, scaly lesions. I don't have a picture of it. Okay. The body may or not heard of ringworm. This is not actually caused by a worm. Many people think it is caused by a worm, but it's not. It's just, for some reason, they call it ringworm, but it's the same fungal infection. These have round, ringed, scaly vesicles. It can be easily passed on from domesticated animals, especially cats. For what it's worth, I've had cats all my life, never had ringworm, so I don't know. Maybe the cats themselves have to be prone to getting it. But this is a picture of ringworm. You can see that the border is darker and bumpy, and the inside is dry and scaly. Then we've got Tinea unguium. I don't know if you've ever seen like those old man toenails. They're like yellow and cracked and brittle and really thick. You know what I'm talking about? Like the typical kind of old man toenails. That's basically what this is. It's the fungi have infected the nails themselves and are breeding in there. Usually from wearing shoes all the time, having socks on all day. They get hot and moist, and they need, instead of airing them out. Same thing with Tinea pedis, which is also called athlete's foot, which is very common in the summer months just because of the humidity and the sweat. This typically forms between the toes, like dry, cracking skin. Let's see, there's a picture here. So this is athlete's foot developing in between the toes because of usually sweaty socks, wearing them too much in the summer. And then you've got Tinea cruris, which is also called jock itch, which are more common in males just because they have a lot more like anatomical things there to like hold on to moisture. they have raised, very itchy vesicles, frequent in the summer when they're playing sports. That's why it's called jock itch. So it just forms in the groin area. And then, let's see. Treatment for all of these are going to be either oral or topical antifungals, depending on just the extent of it. So if it's a smaller area, they do topical. If it's really bad and it's very widespread, they'll do oral. And then trying to just prevent the fungi from growing, just keeping the area clean, cool, and dry. Because fungi love to grow in areas that are wet, dark, and wet, dark. Thank you. So keeping it cool and dry and just like aired out in the sun will help keep the fungi from growing. All right, so decubitus ulcers, these typically are just called bed sores, very common in hospitals or nursing homes, especially with the elderly population for a couple reasons, because their skin is just really thin. Older people have really frail, thin skin. They don't have as much elasticity and cushion as younger people, but also they tend to be more immobile and dependent on others to help care for them. So symptoms of this, it kind of just depends on how deep the ulcer goes. So there's 4 stages of decubitus ulcers, stage 1 to stage 4. The early symptoms are just going to be an area of shiny red skin over a bony prominence. A bony prominence is an area that for example, like the elbow is a bony prominence, like your tailbone is a bony prominence, but like the side of your arm is not. So it's like basically you can put pressure on, and like the bone will put pressure on that area of skin. As it progresses and gets worse, there will be blisters, necrosis, ulceration, and this is just because the constant pressure of the bones and just the body weight on the skin is blocking the circulation so that the blood flow can't get to the skin and it starts dying off. Very common, people that are handicapped or paralyzed or bedridden, can't move. These are diagnosed by looking at it, and to treat these, if someone has a really bad, bed sore, they're going to need specialized wound care, antibiotics, a whole specialized wound care nurse to help deal with the development of the bed sores. Here's kind of a picture of what stage 1, 2, 3, 4 might look like. Stage 1 is just redness. You ever sat on your foot and it goes to sleep and it's kind of red? That if that progresses, that can be a stage 1 ulcer. Stage 2, stage 3, stage 4 can go all the way down through the muscle and into the bone. So, and I've seen these. People come to the hospital because people were kind of neglected in certain nursing homes, and especially on their tailbones, you can see all the way down to their tailbone through all their skin. It's very sad. This is just a result of either neglect or nurses being overstaffed or understaffed and not having time to adequately turn patients, off of their backs or repositioning them every couple hours, so this doesn't happen. Here again is another picture with actual skin. So stage 1 on the far left, just the red heels, just the blood circulation has been cut off for a minute. The first stage 2 is the first layer of skin is dyed. Stage 3 is it's now going into the fatty layer, and then stage 4 is all the way down. That white part you can see is the bone. So very sad. Okay, on to something else that's also gross, scabies and pediculosis. So this is scabies and lice. Pediculosis is the med term for lice. Scabies are actually an itch mite that burrow into your skin, and they're kind of chewing through your skin as they move, so they leave this trail of bite marks. It's intensely itchy. It doesn't actually hurt. It just feels like you want to scratch your skin off. There was a breakout of scabies in this summer camp that I worked at once, and it was the most awful experience I ever had. They're very common in the webbings of your fingers. It just looks like little insect bites in the webbings of your fingers is a very common place, and it's just so itchy that you want to scratch your fingers off. Pediculosis is just the head lice. You'll see the presence of eggs, which are called nits, stuck to the hair shafts. They can also stick to bedding or clothing. So scabies are the medical terminology for those is the Sarcoptes scabii. Those are the itch mites. and then pediculosis depending on which part of the body it's on. So pediculosis humanus is the lice, and then either capitis for on the head, corporis for on the body, and pubis for the pubic area. You'll notice that the capitis and the corporis is like the same terminology as the tinea. So the tinea capitis, tinea corporis. So that Latin root stays the same for depending on the location. Both of these are highly contagious. They're spread by close contact. They can also be spread indirectly from sharing, towels and blankets. Like they can crawl onto those and then pass on to the next person. Hair brushes. So again, overcrowded areas or a bunch of children together, like summer camps, daycares, is very common. Diagnosis, again, just visual exam. Diagnosis is pretty easy in the skin world. For treatment-wise, it's the same medication in different forms. So with lice, it's going to be permethrin shampoo, in the hair. You're going to want to put the shampoo all over your hair, comb all of the eggs out. Some people just opt to just shave their hair off because it's easier than doing all of that, because then you have to repeat it again in 7 to 10 days to just make sure you got all the eggs. Because if you didn't get all of the eggs and there's some that left over, those will hatch, and then you'll have to start the process all over again. So doing it 7 days later will again make sure you've killed all of them. And then you have to wash and dry all of your towels, all of your bedding, vacuum, put medication, or not medications, but like chemicals into the carpet. It's a very big process. Scabies as well is going to be permethrin, but it's going to be a cream that you just put over the localized area. So if you have it like in the webbings of your hands, put it on there. Washing all the beddings and clothing, the same thing. Using extremely hot water, otherwise it won't kill them. And very hot, the highest setting on the dryer as well to make sure you kill them off. This is a picture of what a scabie looks like. Obviously extremely blown up. They're very tiny, microscopic, and that's a picture of what the little bites look like in between the webbings of your fingers. It doesn't look like much, but it is extremely itchy. It is worse than poison ivy. And then here is a picture of lice. So this is what the lice bug looks like, and then what the eggs stuck to the hair follicles will look like. So the nits tend to be stuck to the hair themselves, so they can be very difficult to remove. So that's why, again, some people just opt to just shave the hair rather than have to painstakingly comb out every single one of those. It's going to be a very time-consuming process. All right. Any questions about anything so far? We have 5 minutes left, so I'm just going to get through this one, and then I'll just finish recording the lecture and post it for you guys. You guys can, if you want to stay, I guess you can, but you're also free to go. I'll just keep recording the lecture. Okay, so benign and premalignant tumors. There are certain growths that develop on the skin, and some are completely fine. They're benign. They're just more of a cosmetic issue, and some are actually precancerous. So here is the list from the book of the ones that are benign and the ones that are malignant. Really the only one that's precancerous is the actinic keratosis. The rest of them are just cosmetic issues that don't look great, but they're not worrisome for cancer. All right, so the first one, seborrheic keratosis. This is just a tan, it can be different colors, tan, brown, black, yellow. They're kind of like these papules, which means they're elevated and raised. They can pop up anywhere in the body. They're rough and kind of a wart-like texture. So these themselves aren't cancerous, but if suddenly someone just shows up with a bunch of them popping up all over their body all at once, this could be an indicator that someone has stomach cancer. Not that these themselves are cancerous, okay? So it's not like these need to be removed, but it just could be an indicator that someone has stomach cancer. Does that make sense? Generally, people just have 1 or 2 of these show up. It's kind of common in older folks, but they're not inherently harmful. All right, this is a dermatofibroma. It is also benign. They tend to appear on the fronts of the legs, so this is on someone's shin. They tend to be just kind of like an inflamed reaction to a bug bite or some kind of viral infection. It's scaly, it's hard to the touch, slightly raised and pink, but again, not harmful, just a cosmetic issue. Now, keloids, these are more of a cosmetic issue. They can get really bad. What's basically happening here is that if someone has a trauma to the skin, whether it be from surgery or a cut or someone piercing their ears, for example, and the scar tissue that forms just goes crazy. So hypertrophy is what we call like a rapid overgrowth of cells. So hypertrophic scar tissue is basically what a keloid is that the scar tissue has gone way out of bounds and it keeps growing and growing. It tends to be more common in darker skinned people. They can be problematic because you can cut them off with surgery, but then again, that surgery that you had to remove them will likely also trigger more of this happening. So it's kind of like an ongoing process. You get it removed and then it starts growing again, and then you have to get them cut off again. So some people are more prone to these and they have them, for a long time. I've seen really, really bad cases where like people have like this huge, it looks like a tumor, but it isn't. So again, they're not inherently harmful. They're just cosmetic issues. They can be treated with steroid injections. So you can like inject steroids into them to help keep the inflammation from getting worse, and then compressing them. So to kind of like wrap them with like a compression bandage to keep them from growing as much. But this is just one of those things that is kind of an ongoing issue, because even if you do remove them, like I said, they tend to come back. All right, this one is an epidermal cyst. This is basically just kind of like a very large pimple. The difference is that they have a capsule surrounding it. So you can see that in this picture, under the skin, there's like this sac or capsule that holds all of the pus inside. Basically what's happening here is that it's a sebaceous gland that's slowly filling with fluid. They usually don't hurt. They might be just a little tender, but they're usually painless. They sometimes will have a blackhead pore that you can see on the outside of the skin. They either can burst spontaneously on their own, or a doctor can, scalpel it and drain it of all the contents. It's a foul-smelling pus, and then just treating it with antibiotics. All right, this one, these are very common. These are skin tags. They are also called an acrocordon. They are painless. They tend to be like on places of friction, so like in the armpit where there's like skin rubbing against itself a lot, because the friction causes these. Basically, they're just attached to the skin, little tags. They can just be surgically cut off. They're completely harmless, just a cosmetic issue. And here's the one that is the precancerous one. So this one is the actinic keratosis. These are found on parts of the body that are exposed to sun all the time. So a lot of like people who are truckers and they just sit like in the sun through their car window all the time have these. Long-term UV rays. They have this area of redness with a yellowish crust. And these are a precancerous condition. So these need to be treated with with excision, cutting them out just so they don't develop into something worse. And those are the end of that. I'm gonna go ahead and stop here for those of you, it's about 3 o'clock. We didn't finish obviously, so I will continue to record to finish up the lecture, okay? The lecture should be posted by the end of the day today for those of you who want to watch it.